Coming up on this segment of Out and About Art, we're shining a light on the Arts and Medicine program at the Watson Clinic Cancer and Research Center in Lakeland. Arts and Medicine is a nationwide movement that integrates all forms of expressive arts into healthcare settings in order to provide creative outlets for patients, caregivers, and staff. The Arts and Medicine program at the Watson Clinic Cancer and Research Center offers a full range of creative activities that provide encouragement and comfort during a challenging time. Let's take a look.
Arts and Medicine is about incorporating the creative arts into a healthcare setting in order to improve medical outcomes. And so my role here is to organize the program into three different components, and those components are the environmental aesthetics, or our artwork, which we have a collection of art that will rotate around the center, and then also we have live musical performances. Music instantly changes the environment in the Cancer Center. It is rewarding to anyone who enters, for the staff, to the patients. We've had people who volunteer to play the guitar. We've had a harpist. We've had somebody who plays, obviously, the piano. We have a beautiful baby grand piano. We've had people that will come in and sing for us. And the way that the Cancer Center is designed, it's as a loft. So the music, even though it's played downstairs, it fills the whole building, and it's such a treat for everyone who's here. So we always love to have volunteer musicians. And then also we have our studio where we offer creative activities. And the premise behind that is when we're able to get a patient or a caregiver to refocus their thoughts, it then stops the mind from the perhaps chronic worry pattern. And when they refocus, then the body's automatic relaxation response can kick in, and the person is able then to relax and to calm down. And what it does actually is it resets the body's immune response system, and they sometimes refer to that as the remembered wellness. When the body is able to reset, then they are able to get back to what the body wants to do and to bring itself back to a wholeness. And so Arts and Medicine is about helping individuals to refocus and be able to get back to a state of wholeness. We've recently started using a participant survey for the purposes of finding out what type of a difference we were making here at the Watson Clinic Cancer Center. And the feedback has been phenomenal. People were asking on our survey how their pain is, how their anxiety is, how their mood was and is prior to the activity then and after the activity. And consistently, we're seeing improved states in all of those things from the time they've sat down and started the activity to the time they've finished. We're also asking them, would they recommend this activity? Would they continue doing this activity at home? And in all of those questions, they are answering very positively that it has really made a difference. And another thing that the activities do for them is it creates a sense of community where they can come and they can relate to people who are going through similar journeys. But also what it does is it takes away perhaps that diagnosis, and when they're sitting at that table, they're just like anybody else. It's not about the cancer, it's just about a couple people sitting down, having coffee, enjoying some type of creative arts activity. Our volunteers that we're looking for are really people who are looking to just interact with people. The most important thing that we can often do is just be a listening board to people, to be encouraging, or to simply sit with them and allow them to just enjoy a moment, a break in time to kind of refocus and relax.
My name's Sarah Hesson, and I've been a volunteer for about a year now. Right when I started, it was pretty hard for me to kind of see everything that they were going through. But the more and more I got used to it, I was just like, I am here to give them a little happiness in their day. So that really affected me because now I come here looking forward to not just doing art projects, but also getting to see people that I now recognize. And it's just nice to like see that we are strangers, but if you just sit and do a little art project together or talk a little bit, you just have so much in common, and it's nice to give them a little bit of time where they don't have to think about anything else going on. So for me, it was like I came in looking to just kind of do art, but now it's really nice after doing it for some time to form relationships with some people that you see often or that come in and just tell you how much they really appreciate you. So I actually have heard of some people saying like, oh, I would love to volunteer, but I don't think I could be in that hard of a situation. And what I would say is it's really not hard because what the patients are going through is much harder. So if they can do it, then you definitely can do it. Right when I started, I had no experience with cancer really at all. I had probably like one friend who had gone through cancer. But other than that, when I first came here, it was my first time going through the chemo room. So that was pretty hard at first, but you just have to know that like what you're doing really helps them, and that's kind of the best way to be able to deal with any hardness that it is for you.
My name is Bruni Gauthier, and I became a patient in 2015. I was diagnosed with ovarian cancer, and then in 2017, I returned back with liver cancer. In 2015, with the diagnosis of ovarian cancer, I was devastated, absolutely, and it devastates your family also. So I remember Eva Hawkins coming in and just giving me the smile, and she would bring like pencils and arts, and I'm not an artsy person, I'm a social worker. My career is a social worker, and so I'm not into the arts, but when I started to do the coloring, I was amazed at how less the stress was. I was so grateful for her. And then again, her volunteers would pass by and would say, do you want some chocolate? Can I put a blanket on you? They were so amazing. They were so congenial. It just made my 5 hours here easier. And it also helped my daughter, who was also impacted by this, by seeing how kind they were to me. So I got into the program. I said, whenever I get better, I'm going to go to where the studio is, and I'm going to look at this art because I've never been into arts. And the beautiful part is that honestly, I never thought I had any kind of skills when it comes to art. And Eva was so patient with me, and her volunteers were so amazing. They would teach me, and if I would make a mistake, they would say, that's okay. So it built on my confidence that I was able to do this. And the time that I would spend with the arts and medicine was so valuable to me. I would leave here going, I could make it. I could fight this because Eva's here and her volunteers are here and they're rooting for me. So that rooting for me made such an impact in my life, both times that I've come in.
I was diagnosed in 2010 and went through the whole gamut of treatment, chemo, radiation, and I was going to my support group. And 7 years ago, the gal that was then coordinator was new, and she attended our support group trying to recruit volunteers. I'm a crafter. And when she explained what the program was, right up my alley. So with the blessing of my husband and a lot of friends saying go for it, I signed up to be a volunteer. I tell them over and over, it's easy. If I can do it, you can do it, because I do not believe in making anything that's hard. And that's exactly the way I feel. Sometimes, just an example. Last week when I was here, we were doing button art, like these over here. And they would come up and look at it, and I said, okay, you're here. I want you to pick out a button and show me where you want it put, and I'll put it. And I had several that did that. And sometimes they come back, look at something that we've been doing, and they go, oh, I did some of that. And our wall of CD weaving there, You cannot believe how many people come up and say, I did some of those. So they take pride when they do things. I retired from Watson Clinic. I've been a patient here, so Watson Clinic is like home. And this volunteer program is my way of paying back.
For more information on the Arts and Medicine program at the Watson Clinic Cancer and Research Center, and to find out how to volunteer, visit www.watsonclinic.com/AIM.